Hi friends, let us discuss some ocular emergency. Bacterial corneal ulcer. Bacterial corneal ulcer is a vision threatening disease, and if not treated intensively, patient can lose the vision permanently. So, what are the typical features of bacterial corneal ulcer? The most important thing is vision. The vision is grossly affected in corneal ulcer, especially if it is involving the pupillary area. This decrease in vision can happen over a period of few hours to few days, and patient can be completely blind. It is very painful, and patients may complain of redness of eyes and intolerance to the light. So if you see the symptoms of bacterial conjunctivitis and bacterial corneal ulcer, there is a huge difference. In corneal ulcer, the vision is grossly affected, it is quite painful, and the patients will have intolerance to the light. They may have some redness of the eyes and discharge in the eye as well, but decreased vision, pain, and photophobia, they are very important symptoms in corneal ulcer. So, when you take history in a patient with corneal ulcer, apart from taking the routine ocular history of use of contact lenses is very important, because contact lens related corneal ulcers can be very aggressive, and sometimes pseudomonas infection can lead to complete blindness in few hours to a day. History of any injury to the eye or fall of dust into the eye should always be asked, because that will give you a clue of possible fungal infection. Any previous ocular surgery in the recent or in the past, like refractive surgery, that is laser eye surgery, is very important. When you examine the eyes with bacterial corneal ulcer, you may notice redness of the eye. This redness of the eye is generally around the cornea. That's why it's called as circumcorneal or ciliary congestion. This, in contrast to conjunctival congestion that you see in bacterial conjunctivitis, this is more around the cornea, whereas in bacterial conjunctivitis it is more in the periphery. You may examine the cornea to be cloudy, it's not transparent and crystal clear, and you may notice a white spot on the cornea, or the cornea may be diffusely white as well. You may notice some fluid level in the anterior chamber of the eye, that is the part of the eye behind the cornea and in front of the iris. It is called as hypopyon. It is very important to do the corneal scraping, that is, you scrape the cornea and send it for gram staining and culture sensitivity straight away without delay. If the patient has got a contact lens as well needs to be sent to laboratory for examination for growth of any organisms. Treatment of bacterial corneal ulcer needs to be started straight away. You should not wait for the results, because culture sensitivity may take few days. However, gram staining results can be obtained straight away, and that will help to decide on starting the treatment. Start with intensive course of topical antibiotic drops covering gram positive and gram negative organisms. Fluoroquinolones do work well. You want to give them initially every 1 hourly and then gradually taper it depending on the response. Cycloplegics, that is cyclopentolate or atropine, can be given for relief of pain, and it's very important to monitor these patients very closely. You may want to admit these patients and see them on regular basis to make sure that they are getting better. So when you look at this eye, you can see there is a redness of the eye, but this redness is more around the cornea. That is called as a ciliary congestion, and there's a white spot on the cornea. That is the site of corneal ulcer, and the cornea does not appear very clear and transparent. That is because of the corneal edema. If you look inferiorly at around 6 o'clock, you can see some white fluid. This is the fluid or a sterile pus in the anterior chamber of the eye. This is called as hypopyon. So this is a typical presentation of bacterial corneal ulcer. Hope this presentation has helped you in understanding little bit basics of bacterial corneal ulcer.